Morning, everyone. I'm Dr. Flory Amundala. I am emergency coordinator in concern worldwide in the Burkina Faso. I wanted to present now a topic interesting. So it's a cash transfer in health and emergency context, the cases of Burkina Faso. So this topic is very interesting because sometime in the humanitarian context, they used cash transfer in other sectors like livelihood, like shelter, like agriculture. And now, with concern in Burkina Faso, we pilot this approach in health care to strengthen health systems. Next. Next slide. Thank you. So what is the issues in Burkina Faso? The problematic in Burkina Faso is a security context. So let me tell you Burkina Faso. Burkina Faso is a country located in Africa continent, in West Africa. So it's bordered at north by Mali, east by Niger, southeast by Benin, south by Togo and Ghana, and southwest by Ivory Coast. The country has been shaken since 2015 by a security crisis with enormous humanitarian consequences. Since 2015, the security situation has deteriorated due to attacks by radical army groups, and this has resulted in movement of people to an affected area. The attacks took place in the Sahel, East, Center, North, and North regions, with 40% of the country's territory outside state control. In 2021, the Center-East region was also targeted by armed conflict classified as a priority area in the 2021 humanitarian plan. This situation has had an impact of access to primary health care in the area of repressed and the host populations. Also, protection problems among young women and children. Next. So we can show geographic focus. So the project focuses in 4 health facilities in the Puitenga Health District in the Southeast region. From January to August 2022, Concern Burkina Faso implemented a project to improve access to primary health care with the main objectives. First one, to facilitate the transport and emergency medical and surgery cases to referral health facilities. So to facilitate the transport and of emergency medical surgery cases to referral health facilities, support in the materials, supervision, and accompanying of referral to increase access to early management of gender-based violence, GBV, with the support of the local NGO ASMAT. So Concern choose ASMAT NGO in the local one because ASMAT has a strong capacity to wellness in the community level. So ASMAT awareness people to refer cases and to manage GBV cases. So second one, 2 objectives to help strengthen health systems and the community mobilization. And this objective, we work with community health workers to ensure awareness with the support of the local NGO, with ASMAT in the local NGO. So we give the local communities the different materials to help them for awareness. So next. The following results are expected of this project. Of the project where we used cash transfer in emergency care. First one, integrate emergency and the quality of primary health care for 28,730 IDPs and they host communities. And this one, they will receive health care, including GBV management. So all cases of GBV can receive the care. Second one, to restore a dignity. Second one, to facilitate his access to emergency medical and surgery health care for 130 people, cash transfer. In the cash transfer, the payment of the transport and catering costs to receive secondary health care in hospital. So we give them the food, the food by cash directly, and the beneficiary has a choice of kind of food they would have to eat. So 30 to strengthen coordination between stakeholders, including Ministry of Health and the district and the regional level, and the organization of joint supervision of project activities, the project launch and projects, all activities for workshop and meetings we use together and help us to support the Ministry of Health in Burkina Faso. Next. And then we continue to support the health workers in the provision of quality care services, on the job training, supervision, and drug procurement. And then the staff concerned made a visit to accompany these providers in offering care to vulnerable population in the health area for 4 supported health facilities. And then we support the community's health workers to conduct awareness raising sessions and encourage communities to timely refer GBV survivors to health facilities in the hospital or in central health. They were given awareness kits and trained in awareness by concerned staff. So another one result expected. Local NGO ASMAT played a key role in community-based activities. It was identified to carry out these activities given the acceptance in the community and the capacity building of the staff was done to facilitate their work. In end, 21,004 people received primary health care in the 4 health centers supported by the project. Next. So in total, 140 people benefited from the cash transfer. This one is the result found. And then 132 people were referred to emergency medical and surgery care. which suggests and includes in a referral from 5% to 15 according national standard. This is the FNR was increased. This one is good because from 5% to 15%, it's same of a national standard in the Burkina Faso. And then 8 GBV victims were referred to health facilities. They received appropriate treatment, a Pepsi kit, and money to personal needs. This one is good because it reinforces the dignity of this survival of GBV. So 16,235 people were satisfied to good health practices, and the GBV above the action of the local NGO ASMAT. So local ASMAT give them the awareness and to promote the good practices by health, nutrition, and the GBV topic. This one is good, and as I help them to come in the health facilities when the people are as the victims of violence, and kind of violence is sexual violence. So what is the main challenges? First one, the referral of HPV remain low. So we can see we target 30 person, and we find 8 only. So this one is very low. The main reason we find in her social norm. The social norm is very strong in Burkina Faso. The values and the fear of disclosure of menstruation, and the men have a lot of power in Burkina Faso. So we find as the nation, and the women is case with sexual violence. So this Burkina Faso, the men have very power, and the difficulty to women to go in at the hospital to them to explain I was in the violence of my husband and other one. So we can of next step to focus with how to help the communities and the man and the husband to promote a good practice of all topics in health. So next, the best, yes. This one we know that the customer fair is the best approaches for health care. So the listen only need. First one, the customer transfer. The customer transfer restore the dignity of affected population. So this help them to have a personal capacity to choose how kind of food I can eat, how kind of another choose I can do with the money. So it restores the dignity of affected population in the context of security armed like Burkina Faso context. And the second one is strongest adherence to community of care. So when the population is very happy to receive money and to have the capacity to choose different kinds of food, and sometimes it can strengthen adherence with the health services in a different level of health, and central level and the hospital level. And then the facilitate referral to health care. We see one of referral rate is increased from 5% to 15%. This one is good. And the best practices was close collaboration and the coordination between communities and health facilities. And with this pilot, we found its link is very strong with among communities and health facilities, because the dignity of beneficiary was respected. Next. So for early management of GBV, first one of lesson learned, improving survival access and utilization of services. The GBV referral process required tailored approaches, taking into account to the armed conflict and the displaced context, social norm, and values. This one is good because if we use cash transfer in context of conflict, like Burkina Faso, so we reinforce the dignity of a survivor, and it very aids the survivor can use health facilities to receive the care. So second one, evolving influential people and household and community levels in essential, involving men in the management of GBV activities. So we can involve the men. The men can help its wife to go to health facilities when they have victim of sexual violence, of other kind of violence. So if we continue to awareness the men in the country with conflict context like Burkina Faso, we can help to improve the utilization of health facilities, and we can break the values and norm and the others barrier in the social of like Burkina Faso context. Next. So what is the next steps? So for us in concern Burkina Faso, next steps, we plan to pilot the cash transfer over a long period. So we're looking for others donors to help us how we can use this approach to pilot with a big space and then in long periods. This one is good to have some evidence and to do advocacy for at the Ministry of Health in Burkina Faso, and to talk to them the cash transfer in very good approaches to strengthen health systems and to help beneficiaries to receive the care in the conflict context like Burkina Faso. So second step, please increase the focus of risk community and community. To place increase the focus of risk communications and community engagement. So this approach is very good because the focus of how we can communicate the risk in the populations in context of conflict. It's very good to focus in communication of risk and then to improve engagement of communities, like to use the influences and other people like the pastor, like the imam, like others in the country can help us to promote a good practice of health. So another activities for next steps ensure most vulnerability are targeted. So we can improve our target beneficiary process and to choose who have a need in need, like in extreme poverty, and another one is the vulnerability in the context of conflict arm. So we can assure the good capacity to choose and to do the most vulnerable of our targeted process. So, and then we continue to advocacy for quality of and the timely response to services. So this one is the activities can continue of advocacy, and then we can do an advocacy to Ministry of Health and other donors. This one is good. Next. So thank you. This one I can show two pictures. First one is the activity of cash transfer. The cash given to the father in the hospital of Puitenga Alpha District, and the father of sick children. They receive money to use of food and to pay transport, to reimburse transport. This one, first one is the staff of concern pay the father of the children who is sick. So the second picture is the activity of our local NGO ASMAT, and in the meetings of Alpha Oka, and to give them the capacity how they can do the awareness in the community. So this one is two pictures I want to show you for this presentation. Thank you. Next. Thank you. And if you have some questions, we are available to respond, and our team in concern. Thank you.